The Newcomer Health Clinic was set up to help support refugees in the Halifax and Greater Nova Scotia area during their first year or two in Canada. I mean, refugees have a lot of special health needs, and we really felt that the healthcare system as it was currently created wasn't really meeting those needs.
They didn't want to leave their home country, but because of war or other issues, families that we work with have not been able to access the medications that they need, have not been able to access the services and supports that they need.
Very often they are arriving here with tremendous and complex health needs for conditions that are not met or not treated or not dealt with for a very, very long time.
When patients first arrive with our clinic, we really wrap a lot of supports around them. So one of the first parts is a post-arrival health assessment, what we call PAHA, which is a really comprehensive assessment of our patients' needs and priorities, and then build a plan to address and respond to those.
This clinic is kind of a temporary setup where people come in and then they get connected to your primary care provider. So that is important, that they have access to ongoing care. This group has done a great job, and so our national partners out west, international partners, are all looking towards what is the clinic doing and how are they building that.
When delivering healthcare for refugees, it's critical to be mindful that it's just not, the blood pressure reading in front of you or what you're seeing in the clinic. You have to be mindful of how they access interpreters in other environments, their housing, how they can get their groceries. And so one of the big successes for the Newcomer Health Clinic has been our partnership with our settlement agencies, namely ISANS and the Halifax Refugee Clinic, which is a legal clinic for refugee claimants. And really, the Newcomer Health Clinic was born out of that partnership.
To connect directly between an association like that has a responsibility around language teaching and orienting to community and setting up housing to get their health needs set up, that's where the real innovation comes in.
A language barrier is huge. Most refugee population has very low English majority compared to some other categories of immigrants.
But it's really important that we get really, really good, accurate health information, and that's why it's so important for us to use really good interpretation service to speak with them in their primary language, in their first language.
So this team has really gone over and beyond to create that type of an opportunity. So it is about healthcare, but it is about health and social care, which is what we talk a lot about. It's so much more than the health system.
Over time, as we've gotten to understand the needs and priorities of our patients, we've built in some specialty clinics within Newcomer Health Clinic. So we've built in a pediatric clinic, we have an infectious disease and internal medicine clinic.
We've been able to catch early diagnosis of cancer. We've immunized thousands of people who are behind on their immunization schedules, so we catch them up to the Canadian standard and the Nova Scotian standard.
We've also built in mental health supports and psychotherapy supports.
Because many refugees are arriving with tremendous mental health burden on them.
My name is Nazir. I'm from Syria. I came here because of the war. The whole family were under a lot of stress. But when we arrived here, it was completely different. We felt that we as people mean something. We are valued.
We see the change in the lives of the patients we serve. We see their children start to speak English and get to school and integrate and go on to university, and we see a brand new life in front of us.
When people are heard, they tell you right away. I didn't know that somebody was going to ask me that question. I didn't know that somebody cared. You get to hear every day. So I always say, I have to tell myself, my God, is this really the job I do? But it is.
The awards are nice. I love the awards. It's nice to get publications out there. But really, that's not why we do any of this. We do this because it's the right thing to do. It's that simple.
I think it's very easy when you see a clinic winning an award and hearing all the great things that they're doing to just think, oh, well, they must just have incredible resources. They must have a lot more support than we do in our environment. The secret of our success, the reason why we're able to win awards is because of the people I work with, the doctors, the nurses, the secretaries, and our settlement partners at ISANS and the Halifax Refugee Clinic, who dedicate incredible hours, well beyond what they're paid for, in an incredibly challenging environment because they believe in what they're doing. Their dedication is just incredible and inspiring. This is the way our society gets to a place where we can be proud of the world we live in.